Welcome to RSM's CEO to CEO video series, Leading the Real Economy. I'm Joe Adams, Managing Partner and CEO of RSM US LLP, and I'm talking to fellow leaders about guiding our businesses through the current pandemic and beyond through the recovery. Today, I'm joined by Dr. David Herman, CEO of Essentia Health, which is a hospital system headquartered in Duluth and with operations in North Dakota, Minnesota, and Wisconsin. Thanks for joining me today, Dr. Herman.
Thank you very much, Joe. It's really a pleasure to be here with you.
So before we start, I just wanted to thank you and your employees for all that they've done really to help treat and contain COVID-19 in Minnesota, North Dakota, and in Wisconsin. And so just again, an appreciation for all the hard work.
Well, thank you very, very much. I have to give credit to really a phenomenal team. As you know, nothing has been certain over these last 3 months. The rules change every day. The way we can respond to it, it changes every day. And my team has been absolutely phenomenal. And I'm just so proud of them and amazed at the great work that they provide every day.
So, Dr. Herman, when you think about 3 months ago and what you expected to have happen regarding the level of the caseload of patients and treating the patients, how does that compare to what actually developed for you up in Duluth and northern Wisconsin?
You know, we have been very fortunate here in the northern part of the state where the prevalence has actually been pretty low. We've actually accepted patients from the Twin Cities, from Minneapolis and St. Paul, because the impact of the virus has not been felt in the same way here. We did have several hotspots, several long-term care facilities within our markets had problems, and we were able to step in with that. I'm really proud of the communities and the way that they have stepped up, took social distancing very, very seriously, which made a huge impact in the spread of the disease. Even as things are opening up, people seem to be reasonable. You see a lot of masks going on around here, grocery store, when you go to the hardware store, wherever. So people are really doing a good job. Where it really affected us was in the things, the time-sensitive procedures, the time-sensitive diagnostic tests. Early in this pandemic, our revenues were down 46% because we really shut everything down to try to be ready for this, because we were seeing what was going on in places like Detroit, New Orleans, New York City, as everybody knows, and we did not know whether that would happen here or not. We were able to learn from their experience as a state and as communities, and did a lot of things to social distance, which we believe made a huge impact on that. But we are right now just starting to ramp back up with the procedures, diagnostic tests, and the clinic visits that we didn't do for such a long period of time.
Yeah. So you mentioned talking to other hospitals and really engaging with other hospitals to learn and other systems to learn. What was that like?
You know, it was, first of all, the world literally changed overnight. I mean, one day you were doing one thing, the next day you were doing another, which made a tremendous, kind of mixed everything up. I'm fortunate to be part of a group that gets together on a regular basis of healthcare execs from across the country and really have the opportunity to learn from our colleagues in New York City and Detroit about what worked well for them, what didn't work well for them. So able to glean from some of their experience. And then we just kind of had to hunker down here, made sure we had the PPE, did the best we could to get the testing, and really we met for several hours every morning, several days a week for the first almost month of this pandemic, saying, what should we be doing differently to get ready?
And for you have a number of, I think over 10 or around 10 long-term care type facilities. So what was that like? And obviously with this virus affecting and impacting the elderly at a much greater pace, how did you prepare and revolve around that?
We locked those facilities down to visitors right away, because where you saw hotspots, it was because a visitor or a staff member brought the virus into the facility. So we locked those down right away. We made sure they had adequate PPE, personal protective equipment, to make sure that they could protect themselves and protect others. We went in and we did a lot of training of our staff. We made sure that people were screened at the door, our staff, to make sure they didn't have a temperature, they didn't have any signs. And we did early screening testing of our staff and the residents of those facilities. So far, we have not had a case in any of our long-term care facilities. And I really have to thank the staff for taking it seriously, working very, very hard. So we're very proud of our performance there.
Well, and you should be. That's an amazing feat. I wish a lot of other long-term care facilities had that same result, because it seems to be where it gets started. It really can really snowball very quickly. So that's great to hear. So from a business standpoint, of course, you had to deal with really the change in the non-urgent care that happened with the virus. A lot of that declined. How did you deal with the whole environment there?
Well, we have to make changes. So I asked every one of my executive team to take a 30% cut in pay. I got the board's permission to give myself a 40% cut in pay. We reduced the pay of our physicians to try to get through the cash flow crunch that we knew that we were going to go through as we worked with this. We had to put people on special administrative leave, and unfortunately, Joe, we had to do some layoffs as well. We don't anticipate that the full volume will come back for many, many months. And so some painful decisions needed to be made. Another thing that we did is we said we need to communicate more. So early in this, we had a update literally every day that came from the leadership team to all staff. I did a special letter of my own every Friday that went out. Since this started, I've been doing 2 all-employee forums every week. I'll do one this afternoon, and I'll do one again at noon on Friday, just to keep people up to pace with what's happening with the virus, what's happening in the country, what's happening with the medical center. I believe that your staff does the best when they're the best informed. And if there's anything that I know that I can share with my staff to help them navigate this, it's really better for all of us. So that really changed. We also had to change our expectations. We had a really great year financially going until March 1st, and then everything changed. So knowing people are working very, very hard, doing all the right things, and yet they're still seeing red numbers, we've worked very hard to maintain the morale, maintain gratitude, telling people they're doing a great job because they are, and making sure we're making those personal connections, although we're not sitting together face to face in the office anymore.
Yeah, so you have a rural presence for sure. And as you think about the impact of the pandemic on just rural hospitals in general, what do you think the long-term future holds for that?
I think it will allow us, I think medicine's changed forever. I'll say that when this first started out, I thought that this pandemic would be a point in time. Really, I think it's the beginning of a new era. And I think when you talk about leadership and the job of a CEO, it's to recognize, business people talk about these inflection points all the time. I think for healthcare, we're really at one of those inflection points. And I think it provides us an opportunity and probably some clarity to step back and say, how can we better deliver care in rural areas? We know that virtual visits can be a boon for that. I can have a pulmonologist in Duluth or a cardiologist in Duluth that can reach out to somebody in Ely, Minnesota on 10 minutes notice. Now we have the infrastructure and we can continue to do that. We'll need to say, what does healthcare look like in these communities? What is the healthcare of the future? One of the biggest challenges we have in rural America, and particularly in rural Wisconsin, Minnesota, and North Dakota, is broadband access. How can you do a virtual visit if you don't have broadband access? So we have been working with the legislature, working with our other rural health colleagues to make sure that that can get built. What will it look like? I think we will be touching our patients more often, but all of us will be traveling less. I think we have tremendous opportunities to keep people out of the clinic and out of the hospitals. One of the interesting things we found with virtual visits is one of our dietitians sent us a note and said, this is really great, because what I find now with a virtual visit for the patients I'm treating, I can go into their kitchen with them. If they walk their iPad into the kitchen, I can see what's in the cupboard. When we talk about serving sizes and portion sizes, I can see what they're doing that. I can be a much better assistant to them in them maintaining their health when I can see them in their home. Another big boon has been behavioral health. You can imagine that if you're seeing a counselor for anxiety, let's say, for you to get out of your house, get in your car, drive in traffic, navigate the waiting room, and go to see your provider, all those can be very anxiety provoking. Now you can stay at home, you can have with your counselor, and you're in a lot better position to hear what the counselor has to say, to talk about the ways that you can deal with that. I think this has really changed it forever, and in mostly good ways.
So as the states continue to reopen and things start to move more toward the way they used to be, what opportunities, what challenges do you see heading in the near term?
I think one of the things that we're seeing, we know that Wisconsin opened up its bars and restaurants well before Minnesota did. And living in Duluth, which is right on the border, I can look out the window here and see Wisconsin. Would that make a difference in the prevalence within our state? One of the things that changed was the ability to do virtual visits and the ability to actually bill for a virtual visit. I don't know if you know, Joe, that in some states, you can do as many virtual visits as you want, but you couldn't bill for them. It changed on the federal side. It's changed on the state side. Now what we have to try to do is make sure that those provisions carry forward, and they carry forward, if we can have it happen that way, in a somewhat of, if not uniform, a blended way that allows us not to have to follow different rules in Wisconsin, North Dakota, and Minnesota for the platforms that we're using to deliver those visits. So there'll be plenty of work to do on the legislative side, plenty of work to do on the operational side as we get back to what we were calling here the new normal. It's not going back to where it was, but it's going to be a new normal. And we not only want to be able to navigate that, but we want to be able to shape that as well.
So when you reflect on how Essentia has really endured through this pandemic, what are you most proud of?
I'm most proud of the resilience of our staff. It wasn't, nobody ran and jumped into a hole. I think we spent maybe 10 minutes each day for the first week mourning what we had lost, but then spend the rest of the time designing what we would need to go forward. We also took care of each other. We actually required people on our administrative teams to what we call tap out. Every 15 days, you had to take 2 days off, because if you weren't taking care of yourself, it's like on the airplane. When the oxygen mask drops down, you put your mask on first so you can take care of others. You could see the fatigue of people working 20 hours a day for 10 days. Got to take a couple days off because you won't be at your best. So we made that guideline, we enforced it, we encouraged people to do that. We communicated with each other, and we introduced and lived the concept that I call grace. There is no way you can go online, Joe, and get the book that says Preparing Yourself for and Surviving the COVID-19 Pandemic. And we knew that we were making decisions very, very quickly, with imperfect and not a lot of information sometimes. And we were not going to be perfect in the decisions that we made, nor in the actions that we took. We just acknowledged that, and we were going to give each other grace. We're going to say, okay, we made this decision yesterday. As it turns out, it wasn't the best decision. What did we learn from it? What's the next decision? How do we go forward with that? And we use that term, so if someone in a meeting got on somebody, someone would say, oh, wait, Dr. Herman needs a little bit of grace here. We did the best we could in a particular point in time. And I think that really helped the whole team navigate through this. The other important part, Joe, is that we took a very deliberate step back and we looked at our mission and we looked at our values. And if those could pass the test, of us making the best decision at any particular point in time. They were the right mission and the right values. So we did test them. We found them that to be true. And then when we made difficult decisions, we said, does this further our mission? And is it in alignment with our values? And so it has allowed us to call that out on a regular basis and be able to take that benchmark or North Star to really keep us on our course.
Yeah, I think you mentioned, the vision and the values, mission, really the same kinds of things that we thought about, and glad that we had a very strong culture around values and behaviors, and leading to a lot of our decision making was certainly aligned with that. So I think hopefully all good organizations, all great organizations, I think lead through values and through vision and mission. And it's great to hear how that's been helping you get through this. And I just want to, again, thank you, Dr. Herman, for all that you and your employees have done on behalf of all the patients and others that you've encountered on this last 3-month journey we're on, and certainly wish you all the best in the future as you move on through this pandemic and beyond.
Well, thank you very much, Joe, and thank you for this opportunity to chat with you. And I will tell you this, that in the interactions that we have with your team, they do live your values, they do live your mission, and they've been great partners with us as we've been navigating these waters, and certainly in the waters that we've navigated before.
Thank you. And thank you to our viewers. I hope you enjoyed this conversation as much as I did. For Dr. David Herman, I'm Joe Adams. We'll see you next time.